Hello, everyone. My name is Mark Kageyama, and I'd like to welcome everyone here to be your own hero. I'm a stage 4 prostate, bone, and lung cancer patient slash survivor. Been dealing with cancer since early 2021 and doing very, very well. And I'm so thankful for each and every day. Every day is precious, and our most important and precious commodity on earth is time. And I'm so thankful that I have time to wake up in the morning. I'm blessed every day to open my eyes. And I am so excited for each and every day because each and every day is a blessing. And I am so blessed to have an absolutely outstanding guest. We've we've been talking. I don't know. We've talked a couple of different times now, and
Hmm.
each time we talk for long periods of time.
Yeah.
And she just Jill just mentioned, "Hey, are we gonna do this interview?" I said, "Yeah, that's a good idea." So anyway. I have a very, very, very special guest today. And it's somebody I have not had before. I usually have cancer patients and survivors, but this person is an oncology nurse, an author, a speaker, and she's got so much knowledge, and we're gonna try to delve into that knowledge, and she's willing to share that as long as I could, bring up the subject. But at this time, I'd like to bring on Jill Squire. Please introduce yourself and tell us who you are.
Hey, Mark. I feel like you're talking about somebody else other than me, but thank you so much. I am a nurse for longer than I'm going to say, but decades. And I have had my oncology certification for over 14 years. Um, and I have become very passionate about through that time about patients being patients, survivors, their caregivers, their family members being able to speak up for themselves with ease, with confidence, and with comfort, because that leads to better outcomes, better quality of life, and better decisions through the entire journey. And also among the family members and caregivers and the survivor, being able to make better decisions amongst themselves too. And also have really important conversations amongst themselves about treatment decisions, symptom management decisions, and also going back to work decisions, sexual health decisions, money decisions. There's so many things that are uncomfortable to speak up about. And when you can advocate easily and more comfortably and with confidence, that makes such a big difference in your relationships with your healthcare team, your family, and your caregivers. And I've observed that in my years as an oncology nurse, an oncology navigator, a case manager, and also a support group facilitator. So I have made the decision, as you and I were talking about, to go from full time to part time to be able to devote time towards this movement of being able to bring this to more people other than just the patients I'm dealing with. And so here I am. And I have a book on Amazon right now that you and I were just talking about, Cancer Journey Guide and Journals, Empowerment and Diagnosis, Treatment, and Beyond. Um, it does walk you through. It has very specific guides in self-advocacy, and it has managed to establish me as an authority in self-advocacy. But Mark and I were just talking, and I'm going to be taking that and breaking it up to be easier to go through. It's not a hard read, but I can make it better and make it more engaging, and that's what I'm going to be working on. But it has anyway, it has everything in it that you need, and it has guided journals in it that are phenomenal to use for every conversation, your loved ones, your human resources department, your health insurance company, questions for your doctor. It also helps you address trust issues with your doctor, which is really important to address because you need to be able to call your doctor and talk with them. And if you don't trust them, that's really hard to do. or talk with them at appointments. Usually those can be resolved with that practice or with that physician. Usually it's a misunderstanding, but if it's beyond that, you need to be able to address that. And it walks you through specific steps in being able to do that. That's imperative to have trust in that staff. It walks you through making sure you understand your medications, making sure you understand your diagnosis and your treatment plan, that you track your symptoms, whether you're in treatment or whether you're in survivorship. Those are really important to understand. Um, Returning to work issues, those are important. There's just so many things that are important to you, your next steps. Your next steps are so important to understand, and writing them down helps. There's so many things to go into.
You brought up something in your opening line. You mentioned it a couple times already, and it's something that I speak about regularly on this channel,
Hmm.
is about self-advocacy.
Hmm.
I've spoken about it from the patient's standpoint. Let's talk about how you help people with their own self-advocacy.
Right. So all those pieces we just talked about drives towards that. But understanding what is important to you and having good information, that's key, having good information using credible sources. And writing things down when you're ready to talk or keeping your thoughts together gives you confidence to speak up for what your questions are for whoever you're going to be talking with, whether it's your insurance company, your human resources department, your physician, your spouse, or your partner. That's advocating for yourself. It is pulling together good information. It's pulling together your questions. It's pulling together, it's understanding your thoughts, what you're confused about or what you have questions about. And then it's going to that person with a sense of respect. There's that element to it too. And then it's understanding that you are going to have a dynamic conversation with that person. So you need to listen to their answer as well. And then you need to listen to their answer and you need to think about what they have to say. All of that goes into self advocacy. And then you have a dynamic decision. So that's also shared decision making, but you are advocating for yourself. Also, sharing your symptoms or sharing when something doesn't feel right or when you have a lack of trust. That is self advocacy. That is because this is your body, your diagnosis, your survivorship. In that office, they care about you, but that's their day to day work. This is you. Speak up. Please speak up. And it does help to write things down first.
So, what should a person do? Let's say, okay, let's assume the person's gotten diagnosed,
Hmm.
but they're like not trusting, or they don't like, or they have questions about their physician. What should that person do?
So, first step is to go to a credible source. And I have several listed, but to me, American Cancer Society is an excellent go to. They have lists of just about every type of cancer, and they'll at least explain the cancer to you and the staging. Second step is to bring someone with you to your appointment that can also listen. And also make sure that you do take any information that your oncologist office gives to you and you go through it. That's third step because there is important information. Fourth critical step is ask for and get in a timely manner. And if it's not happening in a timely manner, you keep asking for it and you call your insurance company if it's not happening in a timely manner and get them to advocate for you. You go to your case manager, you go to your navigator, a second opinion. That second opinion will validate your diagnosis. It will um, get involved in your treatment planning decision or validate the treatment planning that's happening. You may end up meeting an oncologist that you like better. Um, it may help you establish trust in your initial oncologist if you find out that the treatment plan that was put together was okay. Also, the other thing you can do, and I'll go back. So that second opinion is so crucial. Even if that second opinion agrees with everything your initial oncologist said, it builds confidence in that oncologist. And that is so important because that confidence takes stress away from you. And that taking stress away helps you maintain your health and your through your treatment and helps you walk into that office with a less sense of dread, right? That second opinion is invaluable. They may also add little nuances to your treatment in terms of symptom management or in terms of just boosting its effectiveness. Uh, the other thing that you can do with that initial oncologist, if you don't jive, is ask for another oncologist in that same office. And you are absolutely free to do that. And don't let somebody tell you you can't, because that is a myth. It's a myth. I guarantee you it's a myth.
I mean, it's so important that that your doc, at least you have to have a level of respect and
Hmm.
appreciation for what they're doing, because
Hmm.
if you don't, then the trust factor
Yes.
is
Right.
not what it should be. And
Right.
trusting somebody who's, your life is involved. I mean, your life is on the line in many
Yes.
cases.
Yes.
And it's so important that you realize that you need to be in control.
Hmm.
And although some people may tell you otherwise, what you're telling us here is you are in control, and
Yes.
you do have control over uh, who sees you. And well, what about the time factor? So many oncologists rush you, want you to get in treatment yesterday. What are your thoughts on that as far as from the patient perspective?
So, it's a scenario, it's a case by case basis. And there are times when you do need to rush because you may have a very aggressive cancer and a day can count, a week can count. And so if you are in the process of getting a second opinion booked, I would not delay care over that. Okay. If you are being rushed, trust me, there's a reason you're being rushed. And it's not that the oncologist wants to dig their claws into you and hold you. It's that because it's hard to rush someone. To believe me, trust me, coming from the oncology office, that is not an easy thing to do. Um, they are advocating for you to get you started in treatment for a reason. And I'm sure that they've probably tried to explain it to you, or if they haven't, please ask, why are you rushing me? Why are you saying I need to start this? Instead of just saying you need to start treatment next week, ask why. Okay, because it helps to understand why. That understanding does make a difference. Still get the second opinion. Absolutely, but don't delay treatment over that second opinion because you don't want to put yourself into a worse situation. Treatments can be changed. Treatments can be shifted to another office if needed. Just don't delay treatment. So that is my thought. Um, the other thing you can do is you can also ask for a remote second opinion, where sometimes that can be done a little faster, where another oncologist, say at a major cancer center, NCI designated cancer center, 3 or 4 hours away from where you live. NCI is National Cancer Institute. Um, looks at your records, looks at what your pathology report came back as, looks at the treatment that was, looks at your biomarkers, looks at the treatment that was recommended, and says, yes, I agree, or no, I don't agree. Oftentimes, those can get scheduled a little bit faster than an actual office visit. So you can also ask for something like that, or even ask for that at the cancer center that's down the street. Um, and sometimes those can be expedited, a televisit. And that can be an expedited second opinion if your treatment's being rushed. So um, there are people that are admitted, especially with the leukemias and lymphomas with very high white counts that are started on chemotherapy right away and have to be. They have to be. And so you really don't have time right then and there for that. But after that happens, you can go for after that white count gets under control, you can go for a second opinion.
That is great advice. Absolutely great advice. And I love your perspective coming from the other side because, you know, coming from where I come from, it's we're
Uh-huh.
only getting, the patient side of it. And
Hmm.
and it's important to hear the other side of it as well because that just helps you make decisions and helps guide you in your
Right,
journey and make
right.
in making the right decisions because that's what it's all about, making the right decisions for you, your life, and your care because
Yes,
uh
yes.
everybody's life is so important
It is.
and
It is.
when people realize it always frustrates me when one of the questions I ask people when they come to me is, how bad do you want to live? And that's tells me something, but it doesn't tell me everything, because of the fact that everybody tells me, oh, I want to live bad. And I expect that answer. But the follow through, uh, it is what I want to see. How
Hmm.
serious are you about following through for your life? And then, I tell people I'm not a doctor, but this is what I did. And, check it out with your people or whatever you need to do. I give the disclaimer and all that kind of stuff, but it's shocking to me how few people follow through and really fight for as many answers as they can
Hmm.
get.
Hmm.
And it just blows my mind um, why more people don't do everything they possibly can. So many people just give it up, just whatever their doctor says. Their
Right.
doctor tells them, hey, you're going to live for 6 months. And they put in their mind, hey, I'm going to live for 6 months. And I see it so many times right at the 6 month period, they're gone.
Hmm.
And
And
that's
mhm.
sad.
It is sad. So, I've seen many people make liars out of those doctors. And it's not that those doctors are liars, those doctors are very good. It's a matter of like you're saying, just we don't know what's coming down the pike in terms of treatment. And if you take very good care of yourself, and that's another part of self-advocacy, is taking responsibility for your health, right? Taking responsibility for your health is if you take very good care of yourself, and that means hydrating yourself, um, eating when you can eat, and working with a nutritionist or a dietitian and getting protein in when you can, and eating fruits and vegetables and so on, and managing your symptoms well. Meaning, if you're nauseated, call. Don't wait till your next appointment. Call and say, this isn't working what you prescribed for me. I'm having a hard time eating. That's important. Maintaining your weight is important. And
Yes.
maintaining hydration is important. It protects your organs. You are not bothering people, you are advocating for yourself. So symptom reporting is really important during active treatment. It's important after active treatment because it might mean something's going on that needs to be looked into. So always report something that doesn't feel the same as normal. It's that self-awareness is another part of advocating for yourself, being aware of your body, but taking good care of yourself, getting exercise. Sleep hygiene, Mark, is one of the best things we can do. What do I mean by sleep hygiene? I mean making sure that you have a nighttime routine where your body knows it's bedtime. You wash your face, you brush your teeth, you turn off the TV, or I go to sleep with the TV on lowly because my husband travels, so I feel more secure, but I have it on very low. And I wash my face with a certain soap every night, but my body knows I'm getting ready for bed and I don't go on my phone and I'm out. I'm out. And I try to get at least 6.5, 7 hours of sleep a night. But that and that habit of making sure you get good sleep every night is so important for your physical health and your mental health and your emotional health. Your body, mind, and soul recharge during that time. And that is so important when you're in active treatment and when you're a survivor. It protects your body. It lets your body recharge from everything that you have going on. Exercise is really important. And it sounds counterintuitive, but if you're fighting fatigue, one of the best things you can do for yourself is exercise. And fatigue is a really hard beast to fight. It really is. But sleep hygiene, good diet, and exercise are some of the best things you can do. It's not taking a medication to fight fatigue. It's taking care of yourself, to be honest.
What do you recommend as far as exercise goes during treatment?
It really is up to the individual person and what they can tolerate. So a lot of people get ports inserted, so you have to be very careful. Like golf oftentimes is not recommended with a port in. So you need to talk with your doctor. You need to ask. Yoga oftentimes is very effective during treatment. And even if you haven't tried it, I suggest that you um, first of all, ask your doctor, especially if you've had surgery, but find yoga for during treatment. Tai Chi is highly recommended, considered very safe. It's a balance. It doesn't sound like it would take a lot out of you, but it does. Walking is a great exercise. Hiking is considered extremely safe, and it's a good, vigorous exercise as long as you're not dehydrating yourself. So keep yourself well hydrated. That's really important. Um, Ask your doctor what you can do. You typically cannot engage in contact sports or heavy sports, but if there's something that you have done always and you want to continue to do, discuss it with your doctor because there are times when your blood counts are low and you don't want to risk bleeding, you don't want to risk injury, and if you have a port, you don't want to risk that moving out of place because that could cause serious, serious issues. So have a conversation with your doctor. But enjoying life is also important. Um, I think hiking typically, as long as you're reasonable about it, and walking are great things to get involved in. And Tai Chi is highly recommended. There are several studies online from Harvard Medicine, from Cleveland Clinic, I believe. Yes, Cleveland Clinic, talking about how well people do with Tai Chi and with yoga during treatment.
It's great advice.
Hmm.
Yeah, I haven't been into either one of them, but I did walk as much as I was so debilitated that I could barely walk, but what did do is I was stuck in my room because I was so limited
Hmm.
mobility wise. But I did make an effort every day to take that one extra step
Yep.
and, accepting really, really small gains, I
Yes.
think is
Yes.
part of the process.
And someone may be saying, well, why is she talking about exercise when talking about self-advocacy? But taking responsibility for your health is a huge part of advocating for yourself in treatment and in survivorship. It's a huge part of it. And then you feel stronger when you're speaking up for yourself if you know that you're doing your part in taking care of yourself, or if at least you're starting at it and you can say to your doctor, I'm doing my part and this is what I'm experiencing. And so I'm still experiencing nausea even though I'm doing everything you're telling me to. I really need, or your nurse or your dietitian, I really need your help here. Um, that's so important to speak up that way. Um, Going back to work, if your treatment is interfering with going back to work and you need to get back to work to maintain your benefits, you need to talk to your doctor about that. Don't just lay down. You need to say, hey, we need to figure out a way for me to manage my symptoms, for me to get back to work so I can stay on my benefits. I've met so many people that are in that quandary. And so write down what is important to you and take it to your, so that you have your thoughts straight. Um, and then that way it makes it so much easier to advocate for yourself because you have your thoughts straight. You have your talking points. Another really good point for self-advocacy, and I did bring up the point earlier, is to maintain a respectful tone. That really does make it a difference. But also approach the conversation, understanding its dynamic, but with the intent of a positive outcome for both parties, because you want to walk away maintaining a good relationship. You have to, this is a dynamic relationship that you want to keep. So you're not going in with all guns blazing saying, I'm going to get what I want. You're going in with the intent of maintaining a good collaborative relationship with this team. And now they may be sour, and I can't always help that. At the end of my book, by the way, there is a chapter of puns because sometimes laughter is the best medicine, and sometimes to get a cranky doctor to crack a smile can really make your day. But anyway, um, if you have a good oncologist and you trust them and they still, and their staff at least collaborates with you and you're getting what you need, you are getting somewhere. Okay, if that helps. The communication is working. If you're working with, say, their physician assistant or their CRNP and their nurse, and you're still getting through and you're still getting your needs addressed. But if you're not, you probably need to find a new team, if that makes sense. If you feel like you're still running into a brick wall and it's just not happening, I would find somebody else. Do not delay treatment over that. Do not.
Jill, we have so much more to discuss. We really do.
Yeah.
And so what I wanted to do, ask you at this time is, would you be willing to come back to shoot part two?
Oh my gosh, if you are willing to have me back,
Absolutely.
absolutely. Yes.
Yes, indeed. I would love to have you back because you have so much knowledge coming from an incredible point of view. I mean, which I think a lot of people are grateful to hear what you have to say because it's so important to help people to navigate this really, really difficult thing. And
Mhm.
it's not easy. There's so many
It's not easy.
complexities,
Yes.
right?
Yes. So understand that oncology care and survivorship, they are very complex. And the people that are taking care of you are experts. And it is a lot of moving pieces. But when you keep track of things, when you write things down, when you keep a journal, it does help. Keeping a journal is one of the most important things you can do. It helps you make sense of those complex pieces. And writing things down, your questions, like we were just talking about everything, Mark. And as I've continued to go through the thread of this, that documentation before conversations of your symptoms, of everything, that is going to help you keep your brain together for this. It really is. And help you have the successful conversations. And I'm happy
And
to come
that's
back.
that would be awesome. I love that. And your knowledge is just absolutely superior, and I really appreciate you. Um, I want to ask you a couple of questions.
Sure.
Uh, what would be your final thought to kind of summarize, what we've spoken about today?
Um, use credible sources of information. So if it's a American Cancer Society, NCCN patient guidelines, um, those are really top ones to go to. Cancer.net, which is from American Society of Clinical Oncology. I have several other ones, but make sure you're using credible sources of information. Write things down, journal things, use your talking points. If you're scared to ask, bring a friend to listen for you. Don't delay treatment and speak up. And if you're afraid to speak up, have your friend with you to speak up, but speak up. It is for you. It is for you.
That's great advice. Absolutely great advice. So my final question for you is this. We live in a very divisive world.
Mhm.
It's chaotic, it's crazy. So how would you help make this world a better place?
Oh, wow. Um, I would. That's a tough question. That's a tough question. I I would hope that I am already through being a nurse and being non-judgmental in every time that I am a nurse to someone, no matter what walk of life they're from.
I think that, I mean, being a nurse in and of itself is requires a lot of passion, a lot of concern, a
Mhm.
lot of caring, and a lot of giving in and of itself. So that, just by being a nurse, you're helping to make the world a better place. And we thank you. But on top of that, you have gone way above and beyond by writing your book and for wanting to help create awareness for cancer patients and both sides as well.
Mhm.
The medical community, the work you're doing is absolutely tremendous. And so I thank you from the bottom of my heart.
Oh, thank you, Mark. Thank you for having me.
Oh, thank you for joining us. And so I want to thank each and every one of you out there for joining us. And we're going to bring Jill back for uh, part two of our conversation, which is we we have so many things that we would like to talk about, and we're going to at least touch on some of them in the next interview. But thank you so much for joining us here at To Be Your Own Hero. Please make a comment in the comment section, and subscribe to the channel To Be Your Own Hero. And I hope that each and every one of you has an absolutely fantastic week. Be blessed, and we will see you soon next time on To Be Your Own Hero. Thank you very much.